Hi, I'm Melanie from UWorld. We're looking at Next Gen practice questions from the UWorld question banks. All right, jumping into the BowTie item here, we can see that this one's unique in the shape of it and then also the way that you interact with it. You actually drag options from down below up into this shape, and they're calling it a bow tie because it does kind of look like a bow tie. In the center, you're picking out one answer option, and then you're going to put two on the left and then two on the right. It's almost like a concept map, kind of. So this is the basic structure of it, and it will always have these kind of directions at the top that say complete the diagram by dragging from the choices. These little words inside of the boxes you're dragging to can change. This is one that we've seen a lot, so this is what the example is based off of, but they can be different sometimes. So thinking about the bow tie item, this is actually a standalone item for the NGN exam coming up. We've looked at individual item types, which can be used in case studies. We've looked at a case study as a whole in other videos, but in this particular case, a bow tie item is a standalone item where you'll get a scenario, and this is the only time that this item type cannot be in a case study is a bow tie. So you'll get the scenario, you'll analyze it, and then you'll answer the whole item by dragging options into this bow tie diagram. So it's still trying to cover every step of the clinical judgment measurement model, which I'm going to pull up here. I talked about this in another video, but this is the NCLEX-PN's model for how do we actually measure that the student, the future nurse here, has solid clinical judgment. So if you look at it, you can see that it kind of aligns with the nursing process a little bit, but really the clinical judgment measurement model is focused on measurement. So what we're seeing is if the person who's answering the question can pick up on the cues that they need to be paying attention to, like, oh, they have a fever, and then analyze the cues of like, what could that fever mean? Prioritize hypotheses. So like, oof, it could mean sepsis. So that one would be our first priority. Generate solutions. What could we do about it? Take action. How do we go about doing that? And then evaluating outcomes. Did that work? What else do we need to do? And then it continues on in just an ongoing circular process from start to finish over and over again as you care for clients. You do things, did they work? Let's start over, recognize cues, decide what we need to do from there. And it kind of mimics the nursing process, but the nursing process is focused on how are you thinking as a nurse, and the clinical judgment measurement model is focused on measuring how you're thinking and if you're doing an effective job of like making those clinical decisions. So with that in mind, this one is not an entire case study. It's a single item only, but the goal is still to test whether or not you can go from top to bottom, recognizing cues, intervening, and then evaluating outcomes afterwards. So we'll kind of think about that as we look at the bow tie item, that they're trying to evaluate us on every step of this within one item. So let's go ahead and pull up the rest of the item here. So this is just the blank form of it. And again, this is the same words in the boxes that were on that other screen. But you can see here where it has the option wells is what they kind of sometimes call them, the option boxes. And then the way that you answer these questions is by picking things up from these wells and dragging them into the target boxes. So you can drag green boxes into the green boxes. You can drag blue boxes into blue, and you can drag purple into purple. So they line up in a vertical column. You can drag these up and you can drag these up. You can put them in there, change your mind, and pull them back down and go back and forth. But you'll be kind of focusing on how this here says actions to take, and so they're going to go in the action to take boxes. So that's kind of the format of it. And so I'm going to go next to an actual realistic NGN-style item that UWorld has put together. So here you can see it looks familiar to the other NGN items because it has the clinical data on the left side. So you'll have your nurse's note, and then you'll have your vital signs tab. So let's go ahead and read a little bit about this patient here. It's a 28-year-old client. They've come in, it looks like some abdominal symptoms. They're in the emergency room, 2 days of cramping, abdominal pain, some watery stools. 4 to 6 per day is quite a bit. They're losing fluids there, which can be dangerous, fluids and electrolytes. The client completed antibiotic therapy recently, which means that their GI flora could very much be out of balance. Like, especially when you take antibiotics, it can throw off your GI system, which is why diarrhea can be a common complication from antibiotics because it's throwing off those microorganisms that typically live in your intestines and do the healthy stuff they need to do, it can kind of accidentally kill those off too while it's treating your infection, and then you end up with GI upset. And then also for female clients, it can cause some vaginal infections because it throws off the vaginal flora as well. So that's something to definitely think about. We've taken antibiotics 5 days ago. Like, could that have caused a complication related to changes in the microflora of our body? Let's see what else. No chronic medical conditions, no medications routinely, and no allergies. They haven't had any nausea, and they've had no blood in the stool, which is great. Abdomen is soft and tender all over, but no rebound tenderness, which is great because that rebound tenderness makes us concerned about peritonitis, which is a very acute abdominal condition that can make them septic very fast. So we definitely want to keep an eye on that, but it's great that they don't have rebound tenderness. Next, we want to check our vital signs tab. And here, at the same time interval, we can see that they're having a fever for sure. That's not good. Pulse is elevated, which oftentimes goes along with a fever, but it can also mean dehydration. And, this person's losing a lot of fluid through the diarrhea, and their blood pressure's kind of dipping down, which also can be related to that fluid loss. Respiratory status looks great, so that's good to know. All right, looking over here at the diagram now, we'll take those pieces of things that we noticed and try to put them together and analyze these cues to figure out what's going on with this person. So over here, we kind of talked about this, but the way these work is these little options that you have here, you can click on them and then drag them up to the box above. And then if you change your mind, you can take it and drag it back down below. So you pick it up by clicking and then drag it over. So that's the way that you interact with this question type. So let's start in the middle, though, I think is the best place to start. It only needs one answer, and then it influences what we do on both sides. Because the center one is asking us what condition the patient's most likely experience. And so we have to think through everything we just read. Gastritis is very much associated with abdominal pain and irritants of the stomach. Thinking about it, they're having a lot of lower GI symptoms with the watery bowel movements. They're not having nausea, and they're not reporting specifically, I'm trying to read again, cramping, pain. They're not reporting that upper gastric pain kind of higher, which is what we expect with gastritis. Pancreatitis is that very, very painful condition, and it's definitely associated with fever, so that's interesting. Ulcerative colitis here, that's one where we really look out for like blood in the stool and pain. They have no blood in the stool, so that kind of helps us think that maybe that's not what's going on. And then C. diff infection. This word has kind of changed recently with the scientific classification. It used to be Clostridium, and then you notice here that it's Clostridiodii. I'm not the best at pronouncing it, but it has changed. But most people still call it C. diff. So that's a C. diff infection, which we all know is a complication that often happens, or when it occurs, a lot of times it's related to antibiotic therapy, which has again impacted your gastrointestinal flora. So I think that would be kind of where I'm leaning here with this person, especially with these watery bowel movements. Watery bowel movements are like iconic C. diff. So we definitely are thinking that cramping. I'm trying to think through. They don't really have that pancreatitis presentation that I think of, even though they're pretty febrile. I think I'm going to go forward with C. diff. So we're going to, again, you click on it and then you drag it up here to the center box. So it'll appear there, and then it disappears from this list. And you can still change your mind and move it back and forth if you want to. So now we've decided C. diff. This is what we're treating here. This is what the patient has going on. So we've recognized, analyzed the cues, prioritized what we think is happening. Now let's start generating some solutions and deciding how we're going to accomplish interventions here. For someone with C. diff, I think the first thing that comes to most people's mind is contact precautions. This is something we talk about all the time. C. diff needs to absolutely be on contact precaution. It is easily spread and it is hard to treat. The bacteria changes over time and is no longer responsive to certain antibiotics, so it can be very dangerous. So we definitely want to look at contact precautions. So I think I'm feeling C. diff. I think I'm picking out contact precautions and going to put it up here. All right. And then now that one, which I feel really confident about, is out of my head, let me look at what the other options are. NPO status, I can definitely see that with pancreatitis. That's kind of really important to give the pancreatitis, or to give the pancreas time to rest here. Antibiotics, that is definitely important. C. diff is a bacteria, so we treat it with antibiotics. Immunosuppressants, that one to me more matches with ulcerative colitis because it's an immune-mediated condition. And then here we have a proton pump inhibitor, PPI, which we all know is one to reduce acid in the stomach. So I think that one is probably matching up with gastritis. So it's interesting the way that for this question, a lot of the options kind of match with other conditions. So it helps us kind of rule them out. But I think for this guy or girl with C. diff, they need antibiotics. I feel really confident about that. They've got a terrible infection is what we're thinking, so they need some antibiotics to clear that up. So we're gonna drag it and put it up here. All right, we've picked our actions out, we've got our condition decided. Now we gotta figure out evaluating outcomes. So we need to know, like, what are we monitoring for this person to see if our interventions are effective or to see if they're having complications from their condition or from our interventions. So looking over here, bloody stools, I think we already talked about, is really related to ulcerative colitis. It is dangerous, so maybe we want to look at that. Lipase, lipase is always elevated in pancreatitis, so I think that's where that's coming from. But I know that we need to measure some blood levels of electrolytes, at least, with C. diff. Abdominal distension can be a site of peritonitis, which is a potential complication of C. diff that is very dangerous. So that one I think is kind of standing out. Coffee ground emesis is caused by bleeding in the GI tract. So that one I think more of a gastritis situation. So probably not that one. Serum electrolyte levels, again, they're losing so much fluid that I worry about if their potassium and sodium and other electrolytes are okay. Starting off, let's definitely do abdominal distension. I feel confident. So you'll click it and then you'll drag it up and it appears up here. And then for the other one we wanted to monitor for, I know I want to go with a lab level. I'm trying to decide, there's 2 lab levels. Let's go with this top one. I mean, these in the middle, let's just go with this top one. So I'm going to click it and I'm going to drag it up here. And then that's all your answers. Again, you can move them back and forth if you want to change your mind, but you've got all the blanks filled. It won't let you progress until the blanks are filled. So got to make sure you do that. And this is one where they told you, hey, I need you to fill in every box. They've told you how many answer options they want you to provide. So they're not going to subtract points from you for clicking wrong options because they told you have to fill in every box. So let's go ahead and click and see our answer or scoring. So for this one, we got 1 point for each of our correct answers here. We got the right interventions, we were right at C. diff, and definitely we want to monitor for peritonitis here. So that was great. We got absolutely 4 points here. This one, I clicked the wrong level that we're supposed to be monitoring for. I think it's definitely electrolytes. Like I said, they're losing a lot of fluid. That makes sense, but I put lipase up here, got tripped up. But because they told us we had to fill in the box, you're not losing a point from this. We did what we were instructed, and so we get 4 out of 5 points. We're not being subtracted a point there, so that's great. So bow ties, I think they're kind of fun. It's unique from other standalone single NGN-style items because it is asking you to go through every step of the clinical judgment measurement model from top to bottom inside of one item. So it is pretty unique and fun to answer. You'll see them potentially later on in your NGN-style NCLEX if you take it after April 1st. The first 85 items you get will not contain those NGN-style standalones, but you can see these later on in your exam as you progress past item number 85. So these may be in your future, and there's lots of them going to be available on UWorld to practice with. So that wraps up today. Whether you're taking the current NCLEX or the Next Generation NCLEX coming on April 1st, 2023, practicing NGN questions will help you prepare for the exam and bedside practice. Visit nursing.uworld.com for more information and to see our options for RN and PN, and to start practicing today.